Vital signs. Vital signs is going to be your next exam. This next exam is not easy. So if you thought body mechanics was hard, this is probably harder. It's a lot of information with vital signs, and I encourage you to study a little bit each day after we go over it, because it is, again, not an easy topic. So, what is a pulse? A pulse is the throbbing of arteries that is caused by the contractions of the heart. Okay, so a pulse is the throbbing of arteries that is caused by the contractions of the heart. It is measured as the number of beats per minute. The volume describes the strength of the pulse. When taking our pulse, we never use the thumb. Can anyone tell me why? You never use your thumbs when you take a pulse. Not no veins. Come on. You can feel the heartbeat in your thumb. Your thumb has its own pulse. So when you take your pulse, if you take your pulse or anyone else's pulses, you're getting bump, 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 bump. You're getting an invalid reading. So we never take a pulse with our thumb because the thumb has its own pulse. You use the pointer finger or the pointer finger and the middle finger together to feel the pulse on the wrist, on the neck, and other places that we will discuss. So these are the pulse points. You do need to know this for your exam, but we're about to actually write out the diagram. So the temporal is on the side of the head. The carotid is at the neck. The brachial is at the arm where you take blood. The radial, you should know this from range of motion, is on the thumb side. This is typically where we take a pulse, is on the thumb side. The femoral artery is at the top of the thigh. The popliteal or popliteal is at the back of the knee. You do not have to worry about the posterior tibial artery because I won't ask you that, but you do need to know the dorsalis pedis, which is on the top of the foot. I'm going to draw it. And then the dorsalis pedis is also known as the pedal pulse, P-E-D-A-L. Well, they can't hear me when I use the Promethean board because my back, or when the sound disperses, it doesn't work that great. All right. Yeah, that can see. Look. The body. All right. So, on the side of the head, right here, is the temporal. Okay, they can see that. Temporal. Side of the head. So when you have that headache and it's throbbing, that is the temporal artery that you feel. Now the one that we check when we exercise on the side of the neck, that is Can y'all hear me? Okay. The one on the side of the neck is the carotid. Carotid. Also note with the carotid that this is also known as the beauty parlor or the beauty shop stroke, the beauty shop side. Beauty shop sign. Beauty parlor or beauty shop sign. Why? Ladies, what is the first thing we do when we go to the beauty shop? None of you go to the beauty shop? Y'all go to everybody's house and get your hair done in the sink? Oh, correct. There you go. So, when you go to the beauty shop and you get your hair washed, the first thing you do is you put your head in the sink and your neck goes back into extension. If you have an occluded artery, meaning that there's blockage in that artery, what doesn't go through it? Blood. So you have a lack of oxygen that isn't going to the head for a few minutes just simply while you're getting your hair washed. I had a patient one time and she was like, yeah, I'm going to get my hair done today, but I can't stand going because every time I go, I'm dizzy. You dizzy? How long? Well, I'm dizzy, and it's about 5 minutes. That's too long for you to be back this long and you get dizzy as soon as you get up. So I did an exam on her, and this wasn't even what she was coming in for, but because she had a complaint that was something so it's common, but people don't think about it. When I did her exam, I couldn't hear her carotid artery. I couldn't hear it at all. And I said, until you go to the doctor and until you get clearance, you cannot go to the beauty shop. Oh, she was mad at me. Well, you're going to have me looking like a chicken head. I said, well, chicken, bark, bark. You better go get this checked or you're not going to be able to go get your hair washed. She finally went, and she had 85% occlusion in the left carotid artery, meaning that any time she was getting her hair washed, she could have had a stroke. So simple, small things like that can save somebody's life. All right, so let's go over here to my fingers. Again, don't judge my art. This is the thumb, right here, okay? That's the thumb. So the thumb is your radial artery. Radial artery is going to be on the thumb side. Just like radial deviation. Temporal carotid radial. Okay. Right here in the arm, where you give blood, this is called the brachial artery. This is called the brachial artery. Now, why did I draw a triangle like that? Yes, to show you it was in this spot, but this also is a location, it's a landmark. The landmark is referred to as the antecubital fossa, because when you look at your elbow, it's an indentation. So it's the antecubital fossa. those of you watching, if you cannot see that, that is Antcueeital fossa, Fossa. Again, the indention in your elbow, the dip, that's called the antecubital fossa, and then the pulse that's in the arm is called the brachial pulse. And moving right along, let's go over here to the thigh. We know this from the bones, that this is the femur, so it's the femoral artery. Femoral artery. This is a major blood vessel, and someone can bleed out if they have a severed femoral artery. Aside from the abdominal aorta, it is one of the major blood vessels that we do depend on. Again, and if you have a traumatic injury and this is sliced open, you can die. Now, behind the knee, that's your patella. Right there. Patella, your kneecap. So behind the knee, that space that's behind the knee, that's called the popliteal. Popliteal or popliteal, however you like to say it, tomato, just as long as you spell it right. Popliteal. And then the last one, again, in the lecture notes, do not worry about the posterior tibialis. I won't ask you that because it's really hard to find. It's where the shin is, and it's difficult to find. So I won't ask you that one. In the foot, on the top of the foot, you have the dorsalis pedis. Or the pedal pulse. People that make it, or people that start their name. Yeah, pedal. You named it. Like this is my pulse. And a lot of this is Latin too, so a lot of it is Latin. Well, the origin of it is Latin. Medical term, the origin is Latin. So again, these are the pulses that you will be responsible for knowing on your exam. This is the easiest way, like I said, that I know to study it. Draw a little man, label it. Print out some pictures, label it. Because repetition is what's going to get you to remember. Go test it out on your family members. That will help you too. Have them just sit. Okay, give me a name. Temporal. Okay, it's right here. Give me a name. Brachial. Okay, that's right here. Repetition is going to get you to understand where these are located better than anything. Not just looking at your notes doing this, because you won't remember it that way. All right, y'all good with this? All right. So continual pulse. These are definitions that you'll need to know. and understand. So Brady is the medical term for slow. Cardia is the medical term for heart. So bradycardia is an unusually slow heartbeat below 60. Now athletes, especially swimmers, they typically come in with low pulse rates. So do long distance runners. Their bodies have become acclimated to reserve their energy, so their pulse is low, which is not a bad thing, but you have to know that. You have to ask that question when you're talking to them, because I've had people come in with a pulse of 47. That's almost dead. But it's normal for them. Typically, if I get an athlete that's 50, 55, 51, I'm okay with that. But when you drop below 50, I'm a little concerned. So I'm going to send you back to your primary care physician. But just know that anybody else that's not a full core professional hard athlete, or even some of the athletes here, that is unusual. Tachycardia, tachy meaning fast, cardia meaning heart, is an unusually fast heartbeat. It's over 100 except in children. Children's little bodies are still developing, so their pulse rates are typically high anyway. It'll start to drop the older that they get. An arrhythmia is an irregular or abnormal rhythm defect, usually in the electrical pattern of the heart. If you remember by the medical abbreviations PowerPoint, we talked about EKG or ECG, and you saw that there was an OPQRST wave, which was a normal pattern. And I also explained to you with that pattern, if it were not an OPQRST wave, it would be a ST wave, or it would be maybe a P wave. P wave meaning that you are barely clinging on to life. An irregular heartbeat is not good in a healthy individual. Some people may have an irregular heartbeat, and that's normal for them, but again, that comes with history and an exam. Anybody else, you need to be concerned. Now, how do you calculate a pulse? I put 3 different types of calculations up here because you can calculate it 3 ways, whichever way you feel is the best for you. Most of us in the healthcare profession are not going to count for a whole minute, but you can do that if you're comfortable. Or you can count for 30 seconds, multiply the number that you have by 2, and that is the patient's pulse. Or you could go a little more advanced and count for 15 seconds for what you feel, multiply that by 4, and that is the patient's pulse. So right now what you'll do is you'll take your hand, find the thumb side radial pulse, find the pulse. That's too low. Come up higher by your thumb. You feel it? You feel it? Feel it? Come over some, Stephanie. Feel it? Feel it now? Alright, so now what you're going to do is pick one of these methods. 15, count 15 times, multiply that by 4, 30, or 60 seconds. So go. Definitely put a TQ by this because it is a test question. Make sure that when you see this statement that you read the question. Pulse can be affected by an increase in exercise. Your pulse is going to rise. Drugs, a stimulant, excitement, a fever. A fever can definitely raise your pulse. Shock and nervous tension. It can cause a decrease in sleep. Their pulse can also be affected by depressant and drugs, meaning that it can drop your pulse. It can decrease with heart disease. It can decrease when someone is in a coma. And it can also decrease with physical training, which we've discussed that already. Yes, you do need to know this chart. Yes, you do need to know this chart. The pulse rate in beats per minute. So beats per minute. Men are 60 to 70 beats per minute. Women are 65 to 80 beats per minute. Children over 7 are 70 to 90 beats per minute. Children under 7 are 80 to 110. And infants are over 100 to 160. Okay, so this one we'll be able to do a little bit of lab today. We'll share with our at-home counterparts. An apical pulse is taken with a stethoscope at the apex of the heart. It detects irregular heartbeats. It can also detect, or it's used to detect, I won't say that it detects, it's used to detect irregular heartbeats, hardening of the arteries, a weak or rapid radial pulse. Let me go back. If you have a weak or rapid radial pulse, meaning that they can't feel it or it's just going so fast that they can't count it, they'll use the apical pulse. It's located at the 5th intercostal space through the mid-clavicular line. And I will show you where that is. I'll show you that on Bob, even though you know Bob done had a rough life. I'm going to show you on Bob, and then we're also going to draw it out so you'll understand exactly where it is. At the bottom here it says, what is common, I don't know why that says it. What are the common age ranges that this is used, the apical pulse? The apical pulse is first used on infants. It's first used on infants because they move around a lot, they're squirmish, they're not trying to stay still. Because you can't just walk up to an infant and say, hey, I'm going to take your pulse, and, you know, pick up their wrist. So the apical pulse is best for them. Second would be the elderly. Because the elderly, they have weak pulses, and sometimes it's very hard to feel. So we'll use the apical pulse on an elderly individual. When you are taking an apical pulse, the apical pulse is here, underneath the breast on a female. On a male, we don't have that issue because you have no breast. But for a female, you need to definitely protect their privacy and make sure that you keep them covered at all times if you have to do this particular exam. Alright, so here's Bob. Where are we on the body? Mid-clavicular line is going to be in the middle of the clavicle. Mid-clavicular line is going to be in the middle of the clavicle. You draw an imaginary line. We're going to go to the fifth intercostal space. The intercostals are in between the ribs. So you'll count down 1, 2, 1 space, 2, 3, 4, 5. This is the fifth intercostal space, and this is where you will listen to the heart. The apex is the tip of the heart. Let me get my heart. So the apex is going to be the tip of the heart. So your heart is here, and you'll be listening here. So that's where the fifth intercostal space comes into play, because you're listening at the tip of the heart. Now remember, when you're looking at your patient, that it's the opposite from you. So if this is your left side, this is their right. And this is your right side, this is their left. So we're going to make some clavicles. Okay, that's your clavicle. And we're going to put the heart right there. Put your dotted line, which is your imaginary line, and you're going to count 1, 2, 3, 4, 5. That should give you the fifth intercostal space. Fifth intercostal space. This is your mid-clavicular line. Your clavicle. And what we're listening for is the apical pulse. Again, when you are looking at your patient, make sure that you flip it. Your left is their right, your right is their left. So if you ever have anyone come up to you and they're trying to listen to your right side for your heart, that is wrong. They're on the wrong side of the body. A pulse deficit occurs with some heart conditions. The heart beats too slow or too fast, in which the pulse is not produced. So all we can do is just count. So we count the apical pulse, we count the radial pulse, and we subtract the apical from the radial, where we'll get what's called a pulse deficit. It's because the heart is not producing the right rhythm. So you get a pulse deficit that gives you sort of an idea where they should be. Stethoscopes are used to amplify sound, and this is what we use for an apical pulse. We also use it to listen to the heart. We also use it to listen to the abdomen. We also use it to listen to breath sounds. So it's not just for the apical pulse, but it is the only way that you can listen to an apical pulse. Yes, you do need to know the anatomy of the stethoscope. There's the headset, which breaks down into the ear tip and the ear tube. You have the turnable diaphragm, which you have the little piece right here. This is called the bell, and the bigger piece is called the diaphragm. Now the bell you use to listen to smaller arteries in the neck or to babies. The larger diaphragm, you're going to listen to bigger organs such as the heart and the abdomen and your breath sounds. Breath sounds from the back. Now it's important that you mention breath sounds because when you do breath sounds, you have to make sure it's skin to skin. The reason why is that if you have clothes on, you're going to hear artificial noise, the rubbing of clothes, and it's going to sound like the patient has something. And you hate to go in and, you just went in for a checkup. Oh, you have pneumonia. But it was really your jacket rubbing together. The stem, I won't ask you about the stem. The tubing and then the chest piece is just the whole diaphragm itself. And I will post the chapter in which this is in to where if you need a reference you can go back and look at this. Okay, so we're going to pause right here. Alrighty guys, we're going to stop here for today and we'll pick back up next class period. If you have any questions, as always, please feel free to email me. Have a good day.